Hello, today we're going to talk about nasal taping after nasal surgery. It's a very important part of the recovery because it allows to mold the nose and improve the swelling and resolution of the swelling after the nasal surgery. Here I've set up pieces of tape, and usually I recommend you do this first on a mirror and set up from long to short, almost like in a pyramid triangular fashion, then the nasal tip pieces, and then one more for the bottom. So when we tape the nose, we start first right down here at the nasal tip. You put the first piece right there, right at the nasal tip area, and then we half the tape up the nose, and we put one piece there, and you want to push down and mold that tip. Afterwards, we put the next halving the tape right up the nose, and it still is a little bit tender during this time. Another piece right like that, right halving the tape right up the nasal bridge, and then the last piece there, very much mimicking the triangular nature of the nose. One piece down here to support the nasal tip. This is the nasal tip strut. And you place that. And before you squeeze the nasal tip, you put one here to kind of anchor those, and then you take these two pieces and you just squeeze, and it's still a little tender, squeeze the nasal tip so that elevates the tip. You take your scissors, you cut this little piece off here, and then one last piece to lasso and support the nasal tip like this, just like that. And doing that in conjunction with what we call nasal exercises, using these two fingers, your index fingers, and just gently pushing with your middle phalange, or the middle portion of your finger, pushing that and giving good support. That helps reduce the swelling as well. Always one side will be more swollen than the other, so you just look at your nose and apply the pressure that way.